Hong Kong is struggling to contain a serious COVID outbreak. So how bad
Yeah,
is the situation right now?
I think everyone's pretty worried. Everyone's pretty worried. Um, I think most people would know someone uh, uh, around them who unfortunately caught the disease. And I think the most imminent thing we need to do now is to help the elderly and the young. I think these are the groups that are most at risk. Just yesterday, we had the peak of death in Hong Kong, so this is it's quite worrying. So I think with limited resources, we're very thankful that the mainland send experts and help. But helping the elderly and the most at risk is the most important task right now. But I think we have to stay confident and united. I don't think it's a time to play the blame game now. I think we should have a united voice, of course, discuss using a scientific method, not to have false information or diverse information that will create panic in society. I think unity and efficiency is what we need right now.
Well, like the mainland, Hong Kong has a zero COVID policy now, but unlike the mainland, Hong Kong hasn't managed to bring this outbreak under control. So, why is that? And how will Hong Kong residents adjust their approaches?
Yeah, I think this is a great question. There's another thing that was mentioned by Han Zheng. It's we have to be prepared, honestly. He said one sentence which I remember clearly. He said even though China's really learned from the past 2 years of our experience, and big cities, even in good days, everyone's prepared. There are enough isolation wards, there are enough volunteers, there are enough medical supplies, enough food supplies in case for a rainy day. And unfortunately, in Hong Kong, we haven't prepared for the rainy day, honestly. So
Mhm.
when it struck, and Omicron being so contagious and spread so quickly, we were caught off guard. I think, the simple truth. There weren't enough supplies. There weren't enough isolation wards. The hospitals were overwhelmed, and suddenly, the snowball started rolling, and the situation get worse. So hopefully, when this pandemic subsides, we really have to think what our strategy is. Of course, we have to follow the whole national strategy, the Chinese way of coping with the pandemic, and how can Hong Kong also work closer with the mainland as well.
The mainland has sent medical experts and has been helping to build the makeshift hospitals. In the past, there's been, oppositions to Beijing's involvement in Hong Kong affairs. Could the central government's actions in this case help change people's minds and possibly bring about a better sense of national identity?
I think so. I really do think so. We are very grateful for all the help we're getting from the central government, and especially those who are at the front lines helping us with our capacity to test with our medical staff. But I think I've been, seeing reactions, of course, on social media and also media. I think most Hong Kong people are very grateful because uh, the simple truth is we are seeing people dying, and we need help, expert help, no matter in terms of numbers or expertise, and we are getting that from the central government. So I think moving forward, as I said, we should really work on more, a structured approach, a cooperation approach, at least with the Guangdong authorities, because this has to happen. Because hopefully, we need the border to open. This is what Hong Kong needs right now. And with the border open, we need to have all the experts and strategy needs to be on the same page. Otherwise, you can't have two different sets of system on both sides of the border. I think this is something that really needs to think about.